We are really happy and honored to be here with you today. And thank you for this occasion. The onset of the COVID-19 pandemic has exposed severe shortcomings in healthcare systems across the globe. In Europe, we have witnessed overcrowded medical helplines, patients being sent home from hospitals, and local health ministries hiring volunteers to follow up with cases. Given the shortage of medical personnel, the continued monitoring of outstation patients with corona or as well other chronic diseases is practically not possible. Patients at home are left to their own devices, where often the course of disease can turn critical abruptly. We are the team from Praxis Concierge, and we have developed Home Nurse, a system to automatically monitor individual records of symptoms over the phone.
Hello, Melina. How are you doing today?
I'm feeling better, but still quite tired.
All right. Did you already measure your temperature today?
Yes, I took the temperature. It's around 39 degrees.
That's actually pretty high, and your temperature has increased since yesterday. Let me mark this here on the dashboard. Do you want to connect to a doctor right now?
No, I think I'm fine.
These calls are triggered automatically in regular intervals and create a diary of symptoms. The system can be operated from a hospital or a health ministry, where medical personnel checks the incoming results on an online dashboard and can take immediate action. The stakeholders of our solutions are the patients, the care providers, and the insurances due to cost savings by timely treatments. What you see here in these bubbles is the number of people per nurse in various regions of the WHO. These bubbles would even be larger for the people per doctor. Shortage of medical personnel, along with aging populations and chronic diseases, is the biggest drivers for solutions in remote patient monitoring. Changing legislations around the world are creating more and more scope for digital solutions here. Many solutions in the market bet on smartphone apps, on wearables, or various kinds of IoT sensors. We believe that with a human-like dialogue over the phone, we can capture the well-being of a patient better than with mere vital statistics. Our solution is built on a scalable infrastructure and can easily be adapted for all common languages. We are convinced that our solution can actually further the progress towards the goals of sustainable development. The low technical barrier can help increase outreach of primary care, as well in areas with low access, for example, no internet remote regions, while the efficiency gain can lead to more resilient systems, healthcare systems. The collected data could serve population statistics for early detection of national and global health risks and accelerate a timely response. Our team combines PhD level expertise in machine learning and especially natural language processing with a strong track record of successful business initiatives. Over the last 8 months, we have successfully developed solutions for automation of phone services in clinics, like appointment scheduling, follow-up prescriptions, and anamnesis before the actual appointment. We have set up companies in UK and in Germany. We are currently implementing our solutions with partners in Europe. We hope the AI for Good community will connect us to a wider range of healthcare players and healthcare institutions. Join us on our mission to make great healthcare accessible for all. Let's make this world a healthier place. Thank you.
Thank you so much, Simon. It's great. Good pitch and time as well. Any questions from the mentors, judges? Yeah, Enrique, please go ahead.
Yes. Hey, Simon.
Hey, Enrique. Hello.
So this is a very, very interesting topic, and I think is something that is going to be a trend if it's not already there, right? Like even more in emerging markets, telemedicine and the evaluation of patients without being really in front of the medicine or the doctor. One question in regards to the trends that you were speaking. So how are you planning to actually cover the different trends that are existing in the emerging markets or in any other markets to grow the capacity of the system? What is the logic that you're putting in the sense of where is the analysis that will go in the future with this technology? Is it maybe, I mean, what I'm asking is maybe just to understand where do you see these going, not just now, but in the future, and how you are tackling that future in the better assessing the needs of the patients?
Yeah, and you mean in terms of the use case or in terms of our scalable infrastructure?
Yeah, let me tell you why I'm asking this so precisely. So I've been thinking and also analyzing some projects in this same sense. And the one big trend or one big issue that everyone is having is they don't really know yet what kind of disease, what kind of problematics they can tackle. I mean, it's very general. Do you already have that interesting trends as a company and as a solution?
Yeah. Yeah, so I mean, what we propose here is really more the system set up for monitoring symptoms. So triggering calls, leading people through a conversation and checking in with their symptoms, which can basically use for chronic diseases, right, like diabetes or heart problems. Or, I mean, we have come up with this system for in the COVID-19 context, where we use a specific questionnaire for COVID-specific symptoms. But in general, I mean, the system can be adapted to any kinds of chronic conditions as well.
And is there any way to measure what is happening in the population in a certain area, region, in what will happen in the future by the diagnostic that you're making? I think yes. How do you see these in the future? What is the I'm going a bit more in the 2 years from now, 3 years from now. What do you see going forward in this?
Yeah, and understand, perfectly understand your direction here. And this is very interesting. I mean, currently we really consider this more as a tool for timely treatment as well, for remote diagnosis and so on. But it's I mean, we perfectly see this as well, that as a tool to collect data across populations, right? And then that would allow statistics based on several regions and give early indications, say, of outbreaks or region-specific diseases as well.
Yeah. So I understand you haven't yet explored the option of having these as a solution for countries or for healthcare systems in regions and stuff like this. That's where I'm going. So it's not yet on the plan that you have. Okay.
Yeah. It's definitely part of our mission and vision, but of our roadmap. But we are not there yet. We are in the market since and the focus has been more on Europe as well, where people is very sensible how do you use their data as well. So we didn't really make this a stronger case so far.
Yeah, but I mean, you have a great solution. Think big. It's an amazing thing. No, honestly, I mean, it's a really great thing. So if it works, you should start from the where you can really go and then go down.
Yeah.
My personal perspective.
Thank you very much. Great idea. Great perspective.
Thank you.
Thanks, Enrique. We're going to make this connection actually afterwards. If any of the startups want to be connected to any of the mentors or the other way around, we will do that. Thanks, Simon, very much.
Thank you.
And I think we have reached the end of our pitching session. And I mean, thanks very much for the startups and for everyone. And also, we've been a bit over time, and I'm sure you noticed, but maybe it's good to hear some very final comments from our mentors and judges before we close. So maybe I'll start with Nicole, because you're short on time. So maybe just a final comment. It can be an insight, it can be something that you saw in the pitching you'd like to let us know about. I mean, what do you think?
First of all, thank you to everybody who pitched. Really inspirational pitches and great topics you're tackling. I think it was really good to see that for most pitches, AI was really at the core of it. And I love for some of you to get in touch with me again, because I even have ideas of how you can maybe deepen the tech component even more. And I think Also have some ideas on how to really make the operating model and the data collection model, right? Because that was kind of critical for some of them, Justice Bot, also for you with the concierge, also ActShift, right? How to get the data right, how to maybe combine different data sources and find other stakeholders that might be willing to pay for what you're doing. So thank you very much. It's been a great pleasure, and wish all of you a lot of success.
Thank you very much, Nicole. Melissa, would you like to just final comment, any insight, anything you like very much, anything you think you can,
yeah, so, you know, as someone who's very focused on, you know, recruiting health tech startups, you know, to join my program, I'd love to talk to you and see if it might be interesting for you to join my accelerator program. I would be interested in understanding how do you currently protect your sensitive data since you're gaining access to healthcare records.
Great, thanks very much, Melissa. And Max, final comments?
No, thank you very much, everyone, for pitching, and then to you, Ahmed, and the fellow judges. I think it's great. And as I was saying at the beginning, there are so many ways that technology can provide solutions to real life issues. I mean, we've seen agriculture, justice, money laundering, health, and the list is so long. So it's very refreshing and a great way for me to end a very long week. Thank you, everyone.
Thank you very much, Max. Enrique?